In this video, I want to talk about what to expect on the day of your cochlear implant surgery. On the day of your cochlear implant, you'll report to either the hospital or surgery center where the procedure is scheduled. You'll first check in, and then you'll be taken to the preoperative area. There you will get changed into your surgical gown, and the nursing staff will review your health history, ask about allergies and medications, go over any medical problems, and place an IV. That IV will be used for fluids, as well as anesthesia medications during your surgery. Then your surgeon will come visit with you. They'll review the surgical plan, mark the ear to be implanted with a marking pen, and answer any questions you may have. Your anesthesia provider will then visit with you, discuss the anesthesia plan, and what to expect with falling asleep and waking up. You'll be able to ask them questions as well if needed. After that, you'll be taken back to the operating room. You'll move over to the operating table and get positioned comfortably on a pillow. You'll breathe some oxygen, and then medications will be given through the IV to help you fall asleep. Once you're asleep, the anesthesia provider will protect your airway. This is usually done with either a breathing tube placed through the vocal cords, or sometimes an airway device that sits above the voice box. They'll review those details with you ahead of time. Next, the table is typically rotated, and the ear being operated on is prepped with a cleaning solution. Sterile towels and drapes are placed, so everything stays clean and protected during the procedure. When the surgery is complete, the anesthesia medications are turned off. Once you're awake and safe, the breathing tube or airway device is removed, and you'll be transported to the recovery area. While you're in recovery, the surgeon will speak with your family, let them know how the surgery went, answer questions, and review post-operative instructions. Meanwhile, the recovery nurses will monitor you closely as the anesthesia continues to wear off. One of the first things you'll typically recognize is there will be a dressing over the ear. When you're more fully awake and the nursing staff feels you're safe, you'll be reunited with your family. The nurses will then review instructions with you, including wound care, how to manage the dressing, and how to take your medications. You'll also be given written instructions to take home. Then once you're comfortable, you'll be able to go home. From a pain standpoint, most surgeons inject numbing medication during surgery, so often there isn't much discomfort right away. Usually your surgeon will recommend over-the-counter medications like ibuprofen and or Tylenol if those are safe for you, and many will also prescribe a small amount of stronger pain medication to have on hand if needed. And that's what to expect on the day of your cochlear implant surgery. So now you know. Thanks for watching.